Hello, everybody. Dr. Val here. Great to see you all. Just fixing my camera a bit. Okay, well, today I am talking all about snoring in women. I don't know if you've heard the saying, snore like a man. And there's a lot of bias in medicine. If you heard me talk before, I talk a lot about how there's a lot of gender bias in medicine, especially sleep medicine. And there was a really big study, about 2,000 people, included men and women, and it was an in-lab sleep study. So we brought these folks to the lab, did a polysomnogram, which is we hooked them all up, looked at their brain waves, had some sensors, some microphones, monitor oxygen, their heart rate, and you can actually measure how loud someone can snore. So in this lab study of almost 2,000 people, it showed that women snored just as loudly as men. And what was pretty interesting is that about a third of the women considered themselves to not actually snore. And then a third of those women who thought they didn't actually snore had pretty severe snoring. So we are not immune to snoring. If you are a woman, we are definitely susceptible to snoring. And the thing about snoring is sometimes I talk about snoring as maybe it's just a nuisance to the bed partner, to family members. However, there really are some health implications from people who do, in fact, snore. Snoring can increase one's risk for having high blood pressure by about a quarter, about 26%, especially if the snoring happened more than 4 times a week. So that was considered pretty frequent snoring. Besides having higher levels of high blood pressure, you can have an increased risk for having weight, extra weight around your abdomen, we call it abdominal obesity, and also increased triglyceride levels. So these are things that are part of your cholesterol profile. Also, from snoring, besides high blood pressure, increased weight, and high triglycerides, you can also have a higher risk for developing diabetes. And this one is actually surprising to me. I hadn't heard of this data by about 50%. That's a lot. And the research that I looked into was really more of observational studies. It didn't really explain too much of the why, but when you take a look at what is snoring, snoring happens when the muscles of the upper airway, typically the tongue, falls back. And so when I talk to a lot of my patients about snoring and sleep apnea, and I know this isn't not about sleep apnea, but snoring is partial collapse of your airway. So just like if someone were to whistle. So, and then if you're holding your breath, or the airway is so small, that's sleep apnea. And so, a sleep study, some of the kits actually don't measure snoring. So, if you are going to get a sleep study to see if you have sleep apnea, I would ask your doctor, your nurse practitioner, physician assistant if it does, in fact, measure snoring. If you're not too sure, there are some apps that are readily available. Snore Lab and Sleep Cycle, I believe. You actually can use the free version where you can get it for maybe about a week or two, and it can actually tell if you snore. You also depending if your phone has enough battery or if you have just a recorder, you can just record yourself if you don't have a bed partner to see if you snore. But I would say the apps are really helpful because it can give you actually a percentage throughout the night if you are one of the a third of women who aren't too sure if they actually do in fact snore. Another thing is snoring is also associated with bruxism. And so what's bruxism? Bruxism is a condition where, something that dentists typically see because you can wear down your enamel when you grind your teeth. So bruxism is a fancy name for grinding your teeth. And so it can go hand in hand. Why? Well, because if you're not breathing well, your jaw's clenching down, you couldn't be moving your jaw around. And the way I think of it is your body's trying to open up your airway to get more air in. And so sometimes moving around your jaw and mouth can help. Definitely, snoring has a positional component for a lot of folks. If you think about what's happening with gravity in the tongue, if you're more on your back, your tongue is falling back to closing off your airway. So, some treatment options for snoring, including sleeping on your side, sleeping a little bit propped up. If you have an adjustable bed, that's a really good option. Sometimes losing weight certainly can help, especially if you have a lot of fat in and around your neck, or even if your tongue is big. There's some research actually where you can do an MRI to take a look at how much fat you have in your tongue. So if you have a large tongue, especially at the base of your tongue, so the part that we can't see back here, that can lead to snoring. Additional things are big tonsils. I have big tonsils. Um, Crooked noses, I talk a lot about the back of the throat, the posterior oropharynx, but if you have allergies or nasal septal deviation, that can also contribute to snoring. And then age, as we get older, what happens to our muscle tone? It decreases. And so the muscles of the upper airway get narrow and floppy. And so snoring, right, is partial collapse of that. So there are age related changes. Alcohol. Some of my patients say they only snore when they drink alcohol. What's going on there? Well, alcohol can make your airway more floppy as well. It relaxes the muscles. Along the same vein are pain medications that relax the muscles, muscle relaxants. So if you do have a concern for snoring and even obstructive sleep apnea and you're on medications or muscle relaxants, it's would be recommended to do a sleep study to make sure you don't actually have sleep apnea. That's the more severe condition that we worry about, even though snoring does have some medical consequences. Sleep apnea we worry about because it can cause lower oxygen levels. And if it's moderate to severe, you can have increased risk for things like cardiac problems like heart attacks and strokes. Yeah. So, in summary, snoring is a very common condition, and a lot of women actually underreport that they snore and don't think that they snore from lab studies. It is associated with things like high blood pressure, increased weight, and even diabetes. And so, if you do snore, please talk to your healthcare professional about it and get treated. Alrighty, if you have any questions, concerns, go ahead and leave them down in the chat. Otherwise, have a great rest of your Sunday, and I'll see you next time. Bye bye. Rest well.